when you're interviewing talent, CNAs, nurses, for example, they're making a decision quick.
I feel like healthcare employers they're in a sort of a competition right now in the market for this talent.
Entry level is tough. They go through the schooling, they go through the clinicals, but that's just a short snippet of what they're going to experience.
It really makes a very strong case for an employer if they can articulate a pathway and a plan for those entry-level employees to get to a point where they can upskill and they can develop their talent. Hi everyone, welcome to this episode of Talent Talk. I'm your host, Rick Martin with Cengage is Ready to Hire. And I'm joined here today by Liandra Chapman, who is a healthcare recruiting professional in the Las Vegas, Nevada area. So Liandra, thanks for joining me today.
Yeah, thank you for having me on. I'm excited.
Great. So let's just kick this off by you telling us a little bit about yourself and some of the work that you're currently doing and add some context to your professional career and your career path and trajectory.
Okay. I've been recruiting for about 10 years. I started off with marketing, went to sales, and now the past couple of years I've been in healthcare. And since COVID, I've kind of seen it all where it's struggling with staffing and just really trying to focus on that culture. So I do help multiple companies right now get out of agency and really kind of just build that core staff from the front lines all the way up to leadership.
Great. Yeah, and I know when you and I first talked, that was one of the things that certainly was on top of mind for both of us, is about this tough market and just sort of the way that they say that there's no issues in terms of hiring healthcare professionals, and the job market's growing, but I do think that it's still a tough labor market out there, and I think that there's a lot to be said about adapting to the talent shortages and trying to shift candidate expectations. So can you talk a little bit more about that?
Yeah, definitely. I agree with you. Talking about talent shortages, it's from what I've seen with healthcare specifically, it's the industry that I've never seen such a high turnover rate, which says a lot. I mean, there's multiple factors, of course. I know people talk about pay, culture, and sometimes it stems from leadership, regardless of pay and culture. If the leadership isn't supporting the core staff, they're going to just jump ship. It's very easy to get any type of uncertainty and just want to just make a run for it. Especially if you look at all the job postings, we're having more people leave than people come in. And that's where I'd say the biggest struggle would be is when you're interviewing talent, CNAs, nurses, for example, they're making a decision quick. They're interviewing the company as well. How fast can you respond to me? I just applied to the job. It's been over 24 hours. I'm going to just go with that first company that reached out to me. They seem to be on their game. If they're that way, then I feel like if I can ask any questions, they're going to be there for me to support me as an employee. That way I can also do my job for the residents, for example. So 24 to 72 hours, even 72 hours is really pushing it. I get there's a huge influx sometimes, and especially when you look on Indeed and ZipRecruiter, people are just applying constantly. Half the time, they don't even research the company until you actually reach out to them. So if you don't reach out to them, in their mind, they're not thinking about you. So, yeah, having that transparency too.
Yeah, of course. I mean, it's like this era of instant gratification. And I think that the workforce now more than ever, especially with Gen Z, is that they want everything right now, and everything has to be quick. So yeah, if you're not on that 24 to 72 hour trajectory, you're typically going to lose candidates. So, and I like what you said too about the pay transparency, and they're interviewing these companies. They're making their decisions. So just as much as a hiring manager is interviewing a candidate, that candidate is quickly assessing that company and that hiring manager right off the bat. So it's one of those things that, we see a lot in the industry. And so I appreciate you adding that context and that perspective. So, so you mentioned when you and I had talked before about just sort of building some work culture. So do you think that there's a big emphasis on culture building?
Yeah, 100%. From my experience, as I mentioned, it stems from leadership. Leadership needs to be involved. That's part of that culture. If they don't know who their boss is, that to me is a red flag. They don't know who to talk to. If they don't know the steps of how to go if they have a concern, whether it's with them personally or something going on with a patient, They need to know that, or even just small celebrations, celebrating birthdays, or I know that can be tough, especially if you have hundreds of employees, but having special like Spirit Week. I like to think of it going back to high school. I'm sure you remember having Spirit Week where it's like every day. People like to be engaged. They like to have fun, and it's also good for the employees and the residents. And, when you're taking care of your employees, they're able to take care of the product, the residents, and things like that. And then it's a win-win. And it's also cost effective. I mean, you could easily do a potluck and you're not forcing engagement. People get excited about cooking and food really brings people together. Or I've also seen where companies do like spirit bucks. I mean, regardless of the company, people get excited if they have a little swag. Even if it's a pen that says the company name, they're like, "Ooh, this is like my pen." Not a lot of people have it, and it's free. People love free stuff. You give them a piece of candy. So just little things like that go a long way. Employee recognition, having their face or their name on the board, it just shows people like, "Oh, wow, there's growth, there's recognition. They care about me here. Why would I want to leave even for that extra dollar? Like I'm happy here. I wake up excited."
Yeah, that's a really good point. Like I think, in the industry that I've been working in which I've been sort of like in education or ed tech and then now into this new role of more of the talent acquisition space. I think that there's, I hear a lot when I talk to people about, we do a really good job of trying to build our culture up, and we do this thing that we have these spirit weeks, kind of like you said. It's kind of like going back to the basics, but one of the things that I think you and I could talk about, and I'm interested in your perspective on this, but with all that being said, and these companies saying that they're doing well and they're able to hire talent, why do you think that there's still a barrier to hiring entry level talent, specifically in healthcare?
Yeah. Entry level is tough. They go through the schooling, they go through the clinicals, but that's just a short snippet of what they're going to experience. And with healthcare, you see so many different avenues. A hospital is completely different to assisted living or skilled nursing. And it can kind of be a smack in the face when you're not prepped for it. And retention starts as early as the interview. I mean, when you're interviewing somebody, you want to be very transparent. You don't want to just, "Oh, this place is great. We love it," and everything. Talk about the negatives too. Just like when you interview someone, you're like, "Hey, what are your flaws?" Like you're trying to pull that out. I know you're not the most perfect person. No one's perfect, but you want to pull out those negatives and educate them on this is what your training process is going to look like. It's not going to be a piece of cake, but once you get it, it'll be a good flow and you'll be more comfortable. Like I'm here as a resource, or this is who you go to. People want direction. And the biggest thing I've seen for, excuse me, for entry level is if they don't have guidance, they're out the door. Sometimes they don't even make it to orientation, or after day one, they're so overwhelmed because they weren't actually prepared for it. And we're human. We're in the people pleasing business. If you're not prepared for it, then why would you want to stay there when there's another company, when there's plenty of ads to apply for where you can actually get what you want for the guidance?
Yeah. Yeah, and then I think that there's also this concept that's floating around out there, and I think everybody has sort of a bias towards it, is that they think that healthcare is a very challenging role, and they feel like there's a lot of stress involved, and so I think that there's some emotion that comes into it. So talk a little bit about like just the overall sort of thought process that you think candidates go through when they look at these entry level positions and some of their predetermined notions on what they think the job is and so on.
Yeah. Healthcare is very demanding, especially emotionally. Dealing with people isn't always the easiest. And the first 90 days of someone starting is very critical. So when it comes to when they want to start, for example, CNA, that's the bottom level when it comes to clinical. A lot of times people aren't educated on the growth opportunities. So if they're not educated on the growth, but they say they want growth, they really don't know what they're looking for. This in their head, they're thinking, okay, I want a promotion of some sort. They need that clear direction of, hey, this person in leadership, they started off as a CNA just like you. They, for example, went to nursing school. They got their degree. They moved up into a leadership role. And now look at them. They're running the whole facility. They want to see that there's actual growth to be had. Not just, I'm going to be stuck here for the rest of my life and I'm already drowning. If you have that clear direction, that those difficult emotional times become really easy, I'd say. And retail doesn't look as glorified, versus something that they chose and they work their butt off just to get there when it comes to healthcare as a career.
Hmm.
So,
Yeah, I think, yeah, that's a really good point. I think that, my wife's in healthcare and my mom was in healthcare. So I come from a background where I'm constantly having conversations just personally about healthcare experiences and healthcare careers. And I think that they go into those roles just like you said, where they want to go into these roles because they're passionate about that work, but they also are looking at these roles and they're going, well, this is entry level, this is a CNA, and I'm starting from the bottom. And I think it really makes a very strong case for an employer if they can articulate a pathway and a plan for those entry level employees to get to a point where they can upskill and they can develop their talent and they can, reach those certifications, which I think you and I have talked about too, that sometimes the licensing requirements and the certifications can be a barrier. And we've seen that in terms of some of these entry level positions or people maybe lacking the resources to get into healthcare, that certification. So talk a little bit about, why you think that there's that licensing or that requirement barrier.
it's not only, like you mentioned, compensate, like paying for it, but it's also time consuming. And if you can't afford to go to the schooling, that means you have another job to supplement that. And a lot of times you're not really seeing younger crowd that isn't married, doesn't have kids. A lot of times you're seeing people that are married and have kids. So that means they have other responsibilities. So to take that extra effort, and at that point, it looks like you have two jobs, that's very strenuous and more difficult to just be able to, oh, I just need to take all this time free. I'm going to study. I'm going to pay for it because I have no responsibilities. Most of the time, people have responsibilities. I think that's why they look into healthcare, because they do see, okay, there's a lot of job opportunities in the market, but I have to get this schooling done. And for a company, it's also a little difficult for them to just be able to entice people with, hey, we offer continued education. That's a big one I see. Like, that's a big selling point. It's not just about what do you pay hourly, but how are you going to help me continue my education and better myself? Because I know it takes a lot of other steps to get to that point as a company. And also it can be a big financial risk at the same time. So legal has to get involved for that one.
Yeah, that's never
But
fun.
that'll help with turnover also. Like that goes hand in hand with culture. You care about me being happy. You care about me doing better for myself. And I think on the long term, it's a win-win for the company, because if I'm going to invest in your education, why wouldn't you stay with me? Because you did it. Now I can put you in a higher level position. You've shown me what you can do, and a position opened up, and now you technically qualify for it.
Yeah.
So CNA is the low, like bare bones. If you can get into that, I know some companies do offer continue education, and they kind of beat others in the out of the water.
Yeah. Yeah, I know that there's a lot of work being done, I think, across different systems about, having those discussions about upskilling and sort of future proofing the workforce. And so, I think that you would agree. We've seen it in lots of conversations, and you and I have talked about it before. But, I feel like healthcare employers they're in a sort of a competition right now in the market for this talent.
Yeah, no, they definitely are. And you kind of, especially for smaller markets, say Tucson. Tucson's really not that large. I'm a strong believer as a recruiter, no matter what, there's different challenges in every market, but you never say, oh, this is not hireable. You will not find anybody. It's not a thing. And if you have to, you're going to fly someone from another state, bring them in and just kind of build from there. So when it comes to kind of just cycling candidates, because at a certain point, it kind of feels that way. You've blasted your ads. You're seeing the same people apply over and over because they're kind of just job hopping. If you look at a lot of resumes, it's 3 months here, 3 months there, because to them, it's just contract work. They haven't actually found a home they want to stay in. So you need to, for companies to really stand out, it just starts, I guess I would say, like before you actually have them come through the door. They want to, as humans, we kind of be a little nosy, I guess I would say. We want to know everything and anything naturally. Like that's just our urge. So pointing at that is, I'm going to tell you exactly what you're going to have within the first 90 days. Like I said, don't just glorify it for positive, because it's not all positive. No job is 100% positive. Even people that just love what they do, they're going to have some stress, hard times. and painting a picture of this is the preparation, this is what we're going to expect, this is the upline, just as much information, but not too much to where someone feels overwhelmed, just enough so that they feel educated and informed to make that decision of this is the company I work for. They've laid out everything. So when an obstacle happens, they know exactly what to expect and they're not going to the competitor, even if it's less money. Because I've seen people leave for 50 cents more. To me, I mean, 50 cents really doesn't kind of make or break you. It's great. It's 50 cents, but it's not going to make or break you. And you're not going to be able to buy that giant house that you want for 50 cents extra a dollar or extra an hour.
Yeah, the perception's off on that for sure, and I think that's where there's an opportunity for healthcare organizations to set themselves apart, and you know, I think that there's something to be said about differentiating yourself in the market and kind of having a solid message for those entry level positions that, if you start with us, you can certainly see that path like you're outlining, Lounger. Like, what is the trajectory? Like, where can I get to? What are I will start as a CNA, but explain to me the pathway forward, and let me know how I can grow my career. And so, I think that there's a lot to be said about organizations being successful in changing their message and shifting that focus on the career progression. Excuse me. So, another topic I wanted to discuss, like you about this hiring in a tough labor market and just sort of the barriers and the troubles that is bringing in entry level talent. But another topic that you and I think we could shift to, if you're ready, is we could talk about like retention and workforce stability. So you've mentioned the
Yeah.
90-day time window a couple different times. So kind of explain that for me. Just kind of do a deeper dive into that, your mindset on 90 days, turnover, retention, and that kind of thing.
Yeah. So what I've noticed, especially since COVID, is when COVID happened, people started to either get laid off or they moved to remote work. And we started to see a huge uptick in remote work. Well, in healthcare, you can't really have a nurse out help you out just virtually, like, hey, you should stick that needle there and give yourself a shot. You're good now. That's
Yeah.
just not how things work. So when I talk about like the 90-day turnover, oh, sorry, Les. I mentioned like before, it starts as early as like the interview, right? So after the interview, though, you hire somebody, you want to be quick to reach out to them. We like you, onboarding. You don't want to delay the onboarding process, but even the onboarding process needs that clear direction for them to want to stay on. People are looking for that flexibility, especially with clinical. Most of the time, people are looking for 12-hour shifts. That means if they're full time, they're working 3 days. And then a lot of times I'm seeing them work two different jobs because they're trying to get as many hours as possible. It's not a typical work week where it's 9 to 5. It's 24/7, and that's how they're breaking apart the days. So they want to have that flexibility, but they also want that work-life balance as well.
Yeah.
So I guess where I'm going at with the causes like staffing shortages, I've seen a more increase in agency, which companies don't really want agency. It's great to have as a backup, but when you have agency in your facilities, that also means that you're having people in and out, which means they're not building connections, they're not getting familiar with leadership or anybody else of the staff. It's kind of just having a stranger in your home constantly, someone you don't know. That's just, hey, I'm here. I'm not really gonna build any connections because I'm leaving tomorrow. Like I have no emotional ties to even do above and beyond.
Yep. They're not
So
up. They're not tapping into that culture that you were talking about. Like they're not even there long enough to experience that. And like you said, their agency work is, it's good to have if you need it, but it's also expensive work. And so, that could be a burden on the organization as a whole. But yeah, I mean, I think that we can look at those first 90 days, and I think that we could both agree that there's a very volatile time period. Those first 90 days, there's a lot of risk involved in terms of turnover. And so it's really important for these employers to build that sense of culture, to build that sense of like, here's your plan, here's what we're going to do. And so I think that there's a need for lots of like early support in helping this onboarding process. So, I think that you and I had mentioned before in a previous conversation that organizations are recognizing that their early turnover is usually involved or is a product of not being as involved in the onboarding and hiring practices. So, I think that causes some of the tension. And then talk to me a little bit about, so then when you're in the door, you've made it through the first 90 days, and then you have this frontline staff now, and hopefully they're not agency and they're working towards, a career path. But, there's a sense that in some cases there's burnout, and burnout is a very real thing. So talk a little bit about your experiences with burnout, like on the frontline staff and things like that.
Yeah. A lot of times when it comes to burnout, it's them being overworked. If just because a facility, for example, isn't an agency, or maybe they're dabbling in it a couple hours of a day, the ratios are also different. So you have one nurse assigned to 10 plus patients. That can be very overwhelming, especially when it's in high demand and you can't be in all places at once. So it's very easy to get burnt out. You're there for 12 hours a day. Sometimes you're there a little longer. Just really depends on the demand.
Yeah.
And if you don't have that support, then you're going to want to just move to a different sector that you feel needs to have a better ratio or a better system in place to where it doesn't feel overwhelming, even though you have a lot of patients. I see a lot of times where it's sometimes when we don't have leadership, then that also means things are just very chaotic. You have people that are not in leadership you're expecting them to act as if they are in a leadership position and take the initiative and the responsibility when it's technically not their job. There's a system in play. That's why we have a structure, and that's why we have the hierarchy, so that we can have smooth systems to avoid the burnout. And for someone in leadership, such as like a director of nursing, just stepping in and, hey, you're doing a great job, or let me help you with this. That does a big thing. Just because you're in a higher level position doesn't mean you can't go back to the front line where you started and help your people. That goes a long way, especially during chaotic times, because it's not always just calm and relaxing to where you can just do your rounds. Everyone's, doing really happy right now. No 911s. But as you know, with healthcare, there's going to be 911s. You don't know when it's going to happen, but at a drop of a hat, you need all hands on deck.
Yep.
That's a big reason for burnout and not paying attention to schedules. We've had staffers, and if they're not paying attention to schedule, they're going to have someone working way more consistently without a day off. And nurses will do that. They will just keep picking up shifts over and over, not even realizing that they're burning out. And we understand they want to make money, but paying attention, that especially as a staffer, that's their job. So then you need to make sure that someone's not putting in too much overtime, because if they're putting in too much overtime, they're going to burn out, and then they're not going to be able to take care of their day-to-day job with what we're looking for. So it's a loser.
Yeah, it's a losing game for sure. And I think that one of the things that I have conversations with quite a bit with people in your position that have experienced the burnout and they've experienced the retention issues is that a lot of times it starts from the top, where you have a nurse, so you have an RN who is now not working at the top of their licensure because they have a shortage of frontline staff, or the CNAs, or the patient care technicians. So, I think that there's, one of the ways that you can really boost that morale and to get these nurses to be working at the top of that licensure is to have that strong support staff that is still willing to show up for work every day and to do the job, and have that good ratio, like you mentioned, where there's like enough help and everybody feels like they have the accountability for one another.
Yeah, definitely. I mean, at the end of the day, everybody's a team. So.
Yeah. Yep. And then one other thing I wanted to touch base on, and I'll kind of just let you run with this, is that as far as, everything we've talked about with the tough labor market, the 90-day volatility, and building that culture, and having a strong interview process, and making sure you have a strong team and you have everybody kind of bought in. What are some of your key strategies for retention and engagement? What are some of your key highlights?
From what's worked with us in the past is consistently doing surveys, and they're not required anything, but just showing that we're taking people's feedback and criticism seriously. And that's not just current employees, but also when people exit. I mean, the only way to do better is to learn where did we go wrong? And that's how, when I worked for one company, how we got better at retention. I mean, their retention was over 100% turnover. That's unacceptable. That means every person I'm looking at today is not going to be here in 90 days or longer. They're just not going to be here at the end of the year. That's insane to me. So that's something that needed to change. We implemented the surveys and just send it to people's email. They can do it when they want to do it. But that helped a lot of feedback as to, oh, leadership's an issue, or they're not getting enough support. They're feeling really drained, overworked. The typical things you hear about. They want to have more engagement with other things too, such as like the culture days that we talked about. They want to feel like, even though when it's at work, it's not a family, we're in the people business. It does feel like a family. And when you're there most of the day, you see people build close relationships, whether they like it or not. Right. Especially in healthcare, like those high demanding jobs, it's, one would say, might be a little inappropriate, but it's natural. Like, we're people and we feed off of energy. So that's a big thing that has helped us. And from there, you kind of just scale it as, this is what the people want. This is within budget. This isn't. So, let's kind of meet middle ground and just slowly get better and better.
Yeah. Yeah, that's great. I think that we need to really focus in on those ways that we can have organizations build that culture, put that emphasis on here's the expectations. And like you said before, there is going to be a time when it's going to be a 911, and so everybody's sort of in the trenches together, and there has to be that sense of community. And I think that starts with leadership and bringing in the right people for the right roles. And that oftentimes, especially when you're talking about entry level, there's ways that you can bring in talent and kind of mold somebody, even if they don't have necessarily the experience. And I think that kind of goes back to what you were talking about, where, if you have a program where you can demonstrate a clear pathway to upskilling and a clear pathway to licensure and certification, that goes a long way for those entry level people. They feel like they're being invested in by the company. So yeah, I really like the premise of just trying to get in those early days and make that big impact. So that's really insightful, and I appreciate that.
Yeah, definitely.
So I will leave you with this then. I will give you the final say. So if you have some advice for anybody that is in a position of talent acquisition or workforce development, and they're looking at ways that they can fix their staffing problems or fix their pipelines or upskill their employees, what are a couple, 2 or 3 things that you think that they should really focus on to change the culture and to turn things around?
First, I would say start with leadership. I wouldn't say it's rare, but you don't always get that leader that is willing to go back to the front lines. Sometimes they rather just stay in their office with their, with doors shut, almost kind of like a hermit crab. And unfortunately, that just doesn't work. People need to see that you're a real person, that they can go to you if they need help, and that you're not afraid to get your hands dirty. So starting with leadership. And then if budgeting is a hard thing, I know there's larger companies, smaller companies. So if it's not in your realm for financially, then just getting people involved in hosting small potlucks here and there. I'm sure there's some decorations in the back that you could just pull together and just make it fun for people to just smile a little harder that day and take it with them to whenever they're helping their residents or whoever it may be. So having more employee engagement, it just starts there, and then just more employee recognition. Just listen to your people. If you're not going to make everybody happy, unfortunately, that's just the way of the world. Right. But just little small recognitions here and there goes a long way. Yeah. So
great. Well, Liandra, it's been fun. I appreciate your time, and it's been great talking with you and having got to meet you before our episode today, and just some of the conversations we've had. I've really appreciated the dialogue. So I thank you for that, and I wish you a great weekend. So hopefully you have a nice weekend on tap, and I appreciate all the insights, and we'll be in touch.
Thank you so much. I appreciate it.
Thanks, Liandra. Take care.
You too. Bye.